Good morning, Mrs. Jill. How are you doing today? Good. My name is Nurse Tessie, and I'm going to be your nurse today, and I'll be removing your catheter. But first, I'm going to perform hands hygiene. I'm going to wash my hands. I'm going to sanitize. I'm going to put on gloves. So how are you doing? Good. Okay. I'm going to be asking for 2 forms of ID. Can you tell me your name and your date of birth, please? Good job. I'm doing that to ascertain the alertness of the patients, to know if the patient is alert. Okay. And then I'll be telling the patient what I'll be doing. So I'll be removing your catheter today. I'm doing that because the doctor ordered it. And secondly, the patient is able to void. Now the patients can void very well, and they don't really need a catheter no more. So I'm going to be taking it out. And because we inflated with the 10 ml water, and we inflated the balloon with the 10 ml water, so we'll be using the same 10 ml water. We'll be putting it here. We'll put it into the balloon to deflate it. We're deflating the balloon so it's easy to pull out the catheter. So we're pulling out. I'm pulling out the catheter, and the catheter is, I'm pulling it out. Pull it out, and I'm going to dispose of it. Okay, I'm going to dispose of the catheter, and I'm going to dispose of the gloves that I used. And this procedure is done because, like I said, the doctor ordered it, and then the patient is able to void now, and then there is no need to have them on the catheter, to put a catheter on them anymore. And then already assess, I'm going to assess, for the female, I'm going to assess the vagina, I'm going to assess the labia, check for if there's any skin breakdown, any irritation or anything. But right now my patient looks good. She doesn't have any skin irritation or breakdown. I'm going to clean the area, make sure that I wipe it dry, wipe the vagina, the labia, everything, wipe it all, make sure it's dry, make sure it looks clean. And then I'm going to wait for like 8 hours and check back on the patient and be sure that the patient can void naturally. If they cannot void, it means, if they don't void, it means they're already retaining water. Then is it that we call the doctor to have them back on the catheter if they are not voiding anymore. Okay, so, and I'm going to do my documentation. I'm going to document how many ml of water I use in deflating the balloon. I'm going to document if there was any redness, any irritation when I pulled it out. I'm going to document, how the performance of the patients while I was doing it, agreeing, was she agreeing, was she disagreeing. I'm going to document all of that, and I'm going to be putting my patient on the bedpan. Okay, so for the bedpan, I'm going to change my gloves. I'm going to do hand hygiene, wash my hands. I'm going to wash my hands. I'm going to wash my hands. I'm going to sanitize, and I'm going to put on a new pair of gloves. Hi, Mrs. Joe. How are you doing today? Good. Okay. Today I'm going to be helping you on the bedpan. Okay. Is that okay? Okay. Can you tell me your name and your date of birth, please? Thank you. Okay. How are you doing today? You doing okay? Okay. So I'm going to be wearing my pair of gloves. I'm going to be wearing gloves. I'm going to be using the regular bedpan for my patients. So the rail of the side where she's laying down, because she's going to hold on to the rail for me. So the rail of the other side will be up. The side I'm working from, the rail will be down, because I'm here to, to help her up. So she's going to hold on the rail, and Miss Jo, we're going to count from 3, okay? 1, 2, 3, and I'm going to help her lift. She's going to lift her butt up, on the side where she has the rail on, where she's holding the rail. She's going to turn over there, and I'm going to turn her over. I'm going to help her put the bedpan gently underneath her. She's going to stay on the bedpan. She's going to be comfortable. She's going to, once I roll out to the side, If I'm on the left side, I'm rolling her to the right so that I can put the bedpan and then she can lay back. So right now she's laying back on the bedpan and she's doing her thing. And she's doing her thing on the bedpan. And then while she's doing that, I can put the rail back on so that it's to protect her in case. So I'm going to give her privacy, because sometimes when you're with them, when they want to do the when they are using the bedpan, some people are very sensitive. They don't like being around people when they want to poop or they want to pee. It doesn't come out. So with that being said, you know, I'm going to give her privacy. I'm going to make sure that I walk away and then give her a call light so that when she's done, she's going to call me, and then I will go back there and then I'm going to help clean her up and fix everything. And I'm going to give her the call light, and I'm going to have her call me when she's done. So right now she already used the call light and she says she's done. So I'm going to already washed my hands again, sanitize, and already put on a new clean pair of gloves. And right now I'm going to help her the same way I pulled her. I'm going to help her. I'm going to put the rail down on my right side because she's going on the left. She's going to hold the rail on the left for me, and I'm going to help her lift her butt up. And then I'm going to lift it up. I'm going to remove the bedpan, and I'm going to wipe. I'm going to wipe her butt from. I'm going to wipe it. I'm going to pat it dry and make sure that everywhere looks clean. I'm going to document if I saw any redness on her butt, or if she had any hard stool, or if it was while I was cleaning her up, if I saw any skin breakdown, any irritation, any bumps, any irregularities, and I'm going to document the amount of poop that she had. Maybe it was formed, maybe it was liquid, maybe maybe she had diarrhea, maybe how much poop she passed out. Was it too much? Was it just a little bit? I'm going to document all of that, and I'm going to make sure that she's in a comfortable position. I'm going to give Mrs. Joe, if she needs water, I'm going to give her water. Whatever she needs, I'm going to give it to her, and I'm going to give her a call light, and she's going to call me if she needs anything. Is there anything you need else, Mrs. Joe? No, she doesn't want anything. So that'll be all for my procedure. And I'm going to discard my gloves. I'm going to wash my hands, and that'll be the end of it.